A facelift procedure or a rotidectomy is a procedure where, depending on the type of a facelift that's being performed, a small scar is made around the ear and typically on the inside of the ear, so you end up not seeing the scar itself. There are different types of facelifts, there are different names for facelifts, but in general, there are two large categories of where that incision is, and that's a facelift and a mini facelift. A full facelift has a scar coming out in the hairline, going around the ear and then behind the ear. Whereas a mini or a minimal incision facelift has a scar going in front, behind the ear, and then stops right here without an extension behind the ear itself. So those are two overall scar type facelifts. Then we have different layers where we actually are lifting. One is the skin that we're lifting, and the next layer is the layer underneath the skin called a SMAS, which pulls the neckline in. And that's called a deep plane facelift. That's one of my favorite type of a facelift procedure to do, which is a deep plane facelift. And that's because it's a facelift that has longevity. If you do a deep plane facelift, it's something that typically you just need to do one time in your lifetime. I generally recommend my patients having that done close to the age of 60. It used to be when you were 50 years old, you ended up needing a facelift. But now with the advent of injectables, Botox, and fillers, we can actually hold most patients off till about 60. And that way they end up having the facelift once in their lifetime. So you do a facelift when you're 60 and then you maintain into your 70s. As opposed to doing a facelift when you're 50 years old and then you end up needing a second one in 60 and a third one in 70. And that's when things start looking done. And those are the scary looking facelifts that we don't want to see. So in general, it's a facelift done timely in a deep plane facelift at a appropriate time is my best recommendation to most patients.